4 CCOs in southwestern Oregon are collaborating to support our communities as we work towards safer and more effective treatment of chronic pain. We have created this video to offer tools and training to those of you who may be serving patients that are understandably fearful, confused, or angry about these policy changes. We have become aware of the terrible consequences related to overuse of opioids. This slide graphically illustrates how this issue is affecting U.S. mortality data. You can see that other countries have seen decreasing trends in mortality over the last 20 years, yet one specific U.S. population is on the rise. When you look more closely at the cause of death, you see a sharp increase in deaths related to poisoning. This rate now exceeds deaths related to preventable accidents and chronic diseases like diabetes and cancer. The United States consumes 80% of the world's supply of opioids, yet we are only 4.6% of the total population. Clearly, action is needed. In this video, we will show 3 perspectives on this problem. First, we have Dr. Jim Shames, who will provide some context for this work, how we got here, as well as where we need to move going forward.
So let's talk about pain, because it's really a component of the human condition. We all have pain. We're born into pain. We often die in pain. And certainly as we get older, we have pain as part of our life. For starters, acute pain is really quite different than chronic pain. When you have an injury, you break a bone, you have surgery, you have a tooth pulled, you have a baby, there is tissue damage which stimulates pain. And the goal of our treatment is to assuage the pain on a short-term basis, get people back to functioning, and let the body heal up on its own. Chronic pain occurs when the healing has already occurred. And there is, of course, some tissue components, but how we feel about the pain, the trauma we've had in our childhood. If we're depressed, if we're anxious, we bring a lot of emotions to that pain, and we can amplify the pain. We can make that pain more significant depending on how we feel. And I think that's really important for us to understand. We have in our bodies natural opioids, so to speak, and they go up and down throughout the day, and they're responsible for our pleasurable response to many things. And we have the ability to overlook certain aches and pains so we can get things done, etc. And those are very important parts of our daily living. When you take an opioid, something from outside your body on a regular basis, you overpower that natural system. And that part of your body just kind of goes to sleep. It says, okay, you don't need me anymore. I'm going to shut off. And so now you are fully dependent on external substances to relieve all sorts of pain, even emotional pain. When you stop, after you've done that for a while, you have withdrawal. And it can be extremely uncomfortable. You have no protective mechanisms. You don't have those natural opioids anymore. And your body can be screaming in pain. You can have all sorts of symptoms. And that's very hard for people to tolerate. And it can go on for days to weeks to months to some extent. And that's what physical dependence is. And everybody will become physically dependent if they take enough opioids for a long enough period of time. So the real tragedy here is that although opioids can be so effective when you're in a great deal of pain acutely, the effect wears off. We become tolerant to the benefits of opioids. And so over time, opioids perhaps have about a 30%, for most people, about a 30% effectiveness of pain treatment. And that's not really very much. Good quality sleep, adequate exercise, mindfulness, CBT, those things actually, for most people, are more effective than opioids in relieving pain. So opioids have significant side effects, they have definite risks, and the benefits are modest at best. I think it's very easy to get confused between the concepts of physical dependence and addiction. So physical dependence is the withdrawal that people will experience after they've been on a substance for a while and it's been removed. And some substances will do that and some won't. You could take amoxicillin for 30 days and stop it and you'll have no withdrawal reaction. But if you take opioids for 30 days, you're going to get very sick when you stop. And that's universal, and that will happen to everybody. Some people, either due to genetic predisposition or exposure to a lot of the drug or societal factors or all three, are at risk of losing control of the medications. Not only will they experience withdrawal, but they will find themselves pursuing the drug, obsessing about the drug, doing things to get the drug they would not otherwise do. And once you've lost that control and given yourself up to the medication, you're exhibiting signs of addiction. And some people say as many as 25% of individuals on chronic opioids will become addicted. And I think it's important for us to realize this could happen to everyone. So one of the questions is, how did we get here? And I think it's helpful to go back in time and realize that 30, 40 years ago, we didn't really have the same concept of chronic pain. We certainly knew opioids were useful, and hopefully we used them appropriately for people that had injuries and appropriately for people who were dying, who had end-of-life issues, who had ongoing pain due to cancer, for example. But we weren't using opioids for back pain and headache pain and shoulder pain. And a cultural shift occurred. Some of it, I think, was throughout the culture in general, where we came to believe that there was going to be a pill that would solve all of our problems. We did direct advertising on television for pharmaceuticals. We're one of the very few countries that does that. And I think that we've created a culture where, as I said, people expect that if something hurts, there's going to be something safe they can take that's going to help take the pain away. Purdue Pharmaceuticals produced oxycodone, became one of the most popular selling drugs in the world, and we were led to believe that this drug was safe, wouldn't cause addiction, that if people complained of pain, it's because they weren't taking enough medication. And that turned out not to be true all around. So I want to acknowledge that the people at the front desk, the people who answer the phones, the medical assistants, the nursing staff, the ones who probably interface with patients much more than the prescribers do, that you all have a difficult but very important job, and that patients respect you, they listen to you. You know, you in many ways are an extension of the providers in the exam room. I think it's really important for you to understand the same message that the prescribers are learning as well around the safety of opioids, some of the dangers of opioids, and techniques to help people go from opioid dependency to being independent of those medicines and learning to manage their medications on their own.